Hello, my name is Adriane Martin-Hilber, and I'm a senior project leader at the Swiss Tropical and Public Health Institute. It's a pleasure to be online for this important consultation, and thanks to Rima and Malia for helping make this all possible. The construct that I was asked to talk about was 1.2, an indicator that holds local and district governments accountable for monitoring maternal health outcomes at the community level. The formulation of it as an indicator was the number of district local governments that articulate efforts of sectors accredited to its geographic area and monitor results in each community. The initial formulation clearly aimed to capture the accountability of local governments at subnational level to monitor maternal health outcomes at community level. As formulated, however, it's hard to understand. First, the level of government targeted is unclear. It could either be community level, district level, so this needs to be specified. And the second issue is what is exactly meant by governments that articulate efforts of sectors accredited. These issues could be interpreted in many ways, but we think that they should be interpreted as governments putting in place accountability mechanisms to take account of community maternal health outcome monitoring. When we look at the construct, a number of questions and concerns are raised. One is, when we talk about government accountability, are we talking about government accountability for or to communities for maternal health outcomes? Are we measuring social accountability, or are we measuring professional accountability of health providers, or are we measuring something else completely? When we talk about accountability, we also mean something that involves recourse or responsiveness. Who is responsible, the government or the community, for the monitoring, and who is responsible for the enforcement of it? Given the importance of registering maternal health outcomes, whether at community or facility level, we think it is an important dimension to monitor and measure what is well overdue in the fight to end preventable maternal mortality. Social accountability efforts around the world have been employed to call local health authorities beyond to account for access to quality maternal health care. They've used scorecards, audits, town meetings, facility committees to voice concerns of rights holders at community level. Some of these calls have been acknowledged by the health sector, usually at facility level, through dialogue meetings that even result in joint action planning to improve maternal health. In general, such efforts have raised awareness among both rights holders and duty bearers, in this case, providers and managers, around what is happening in their community related to maternal health, which can pave the way forward for improving access and use of quality maternal health services. Measuring maternal health outcomes by the community can be understood as social accountability actions. If done well, the data can complement what is known about maternal health outcomes at the facility level. Collecting data at community level is challenging but possible. Other data is also collected at the community level by village chiefs, community health workers, social outreach workers. They do it on environment, they do it on things like WASH, also on employment, housing. Why not on maternal health outcomes? Based on these considerations, I suggest a revised, hopefully more specific construct and indicator for measurement. The new formulation would continue to be an indicator that measures responsiveness or accountability of local and district government to the results of civil society monitoring of maternal health outcomes at community level. The indicator would be the number of district governments that have established mechanisms for collection, review, and response to community-led monitoring of maternal health outcomes at community level. If you look at the way I've phrased it, there's a number of issues that need to be clarified. One is the issue of what is an established mechanism. An established mechanism, I understand to be an established process by which something takes place or is brought about, a recognized system or method for achieving an output or an outcome. These could include, for example, internal controls, audit protocols, citizen scorecards, that are publicly available through reports or standard operating procedures, etc. Another issue is collect, review, and response that we ask for in the indicator. The government, we understand this to be that the government puts in place through laws, policies, regulations, or norms, systems to ensure community monitoring and reporting on maternal health outcomes. Of course, the mechanism that's put in place would have to be supported by financing and other resource allocation. And there would have to be the capacity of the institutions to identify access and other barriers and strategically address them. And this also must be measured. Of course, in this case, when we talk about the government, we're talking about the Ministry of Health, because we're talking about maternal health outcomes. When we think of collection, review, and response, it also speaks to the issue that the systems need to facilitate community audit and reporting of every pregnancy, not just those that go to the facility, but every pregnancy, and that the health system has a mechanism in place to monitor, review, and act on the data on health service delivery failures and challenges as well as they're identified, and then to have revised plans, programming, or quality improvements take place. Otherwise, the community, in fact, would not want to get involved and would not be motivated to collect the data. Community-led monitoring of maternal health outcomes at community level, that was another issue of the new formulation. It measures if community stakeholders and institutions responsible for implementing the accountability mechanism have the technical capacity to do so, and how capacity is being built. Here we must note the relationship between the implementing institutions or communities and the power dynamics within and among stakeholders. All of these things have to be taken into consideration. When we look at the state of measurement, a number of issues come to mind. The status of the data, for one. Community monitoring and reporting can be institutionalized as a health sector indicator at district level, either directly by community leaders or community health workers. And it can be, the implementation can be at the district health sector for the response mechanism. The capacity improvement issues, it can also be measured by organizational assessments, things like internal control assessments or accountability self-assessments, community scorecards, or other accountability tools. And achievement through benchmarks on a capacity plan could also be used. The measure would also have to look at change over time of maternal health outcomes at community level, which can be compared and compiled to complement institutional data. The source and timing of the data, likely the data would have to be collected through project reports until measures are incorporated into the health system monitoring, for example, through health information systems. And it would likely have to be collected on a monthly basis in order to achieve the same kind of complement to the health sector data. This particular formulation of the measurement has been drawn from World Bank governance indicators, as well as the Measure Project's Family Planning and Reproductive Health Indicators database on health systems and policy environment, and the USAID leadership and governance indicators, all of which speak to accountability measures. When we talk about measuring this construct and construct validity, we see that the measure as proposed established mechanisms for collection, review, and response of community-led monitoring and maternal health outcomes. We find it to be clear, but needs to be predefined through law, policy, regulation, and standards. That means for it to work in countries, there would have to be a national institutionalization of the measure for it to work. Measurement of accountability must put the onus on the health sector and not on the communities or the civil society to report on how they respond to demands for social accountability. And concern about power dynamics may necessitate parallel reporting by community representatives and the health sector independently. This is something to consider, that in fact the community could report up to the district and not through the health sector, so that they would not be subject to, for example, bias or pressure from the health sector. Feasibility and data availability, when we think about that, the data can be obtained from civil society and stakeholder projects or through the health information system governance indicators. Maternal health outcome data is already reported at facility level. Adding a community level reporting can be done through existing channels, as I mentioned, or directly through local governance indicators. How the mechanism is established should include monitoring and reporting. One possibility could be through the district health management teams. In terms of harmonization, adding community reporting on maternal health outcomes and comparing the data to facility-based data can strengthen health system response, mitigation of access barriers, and empowering communities through control of their own data as a benchmark. Health system response mechanisms could be monitored through existing district health management team meetings, health facility committees, or community-based governance mechanisms. The indicator lacks redundancy and does not measure something already captured under other indicators. And the community data collection would complement an MDSR process by providing community-based surveillance data. In terms of relevance, measuring the effect of civil society and community monitoring of maternal health outcomes can increase the responsiveness of duty bearers to deliver quality maternal health care by supporting EPMM strategies for reducing preventable maternal mortality. Community engagement in localized maternal health outcomes adds to the global evidence around births and deaths, and morbidity actually, outside of the facility. Evidence from community maternal and neonatal death audits support this finding. And finally, interpretability and usefulness. The social accountability mechanisms such as scorecards, audits, and health facility committee engagement have demonstrated that there is evidence to support the effectiveness on process and some outcome measures. And results from the comparison between community and health system reporting on maternal health outcomes would strengthen the commitment to monitoring, reviewing, and acting on the results that can improve maternal health services at all levels. In summary, we're proposing an indicator that measures responsiveness, accountability of local and district government to the results of civil society monitoring of maternal health outcomes at community level. The indicator would read number of district governments that have established mechanisms for collection, review, and response to community-led monitoring of maternal health outcomes at community level. The rationale is based on increasing government accountability for maternal health outcomes at community level. And the need for that, the governance indicators demonstrate that monitoring and reporting on community level data is possible. Health sector data can complement community social accountability data, and community monitoring and audits would strengthen the commitment to monitoring, reviewing, and acting on the results that can improve maternal health services at all levels. Thank you very much, and I look forward to the following discussion that comes in the coming weeks.